piece of the puzzle now revealed. Keep questioning, keep listening. Only on Nigeria Info 99.3. This is not just a debate. It's a battle of minds. A clash of brilliance. A war of words. And only one champion. One true champion will rise. From the heart of the capital, Abuja.
We live in a world where 735 million people suffer from hunger, a crisis fueled by climate.
From the oil city, Port Harcourt.
You see, with less time to focus on short-term gains, like how to appease voters before the next election.
From the city that never sleeps, Lagos.
Who is the right leader? The proposition might say someone who is bold and decisive, but I oppose this belief.
The regional champions are ready. The stage is set. The stakes higher than ever before. Who will outthink? Who will outwit? Who will dare to differ? Catch the I Beg to Differ National Finals live on all Nigeria Info FM and Kids FM stations nationwide. It's intellect, it's passion, it's the future in action. Debate redefined. The IBTD National Tournament begins August 4th, 2025, only on Nigeria Info FM and Kids FM nationwide. For sponsorship, call 0805-581-5844 or email ibegtodiffer@nigeriainfo.fm. I Beg to Differ, the Tournament of Champions.
Welcome back to your number one talk, news, and sports station. This is Nigeria Info.
Nigeria Info.
This isn't a Game of Thrones. It's a game of information.
The German foreign minister went to Beijing to reaffirm that Europe would not let China invade Taiwan.
And more information.
Government can't keep taking the fall for your own mess, for your own mistakes.
And more information.
We did some work on the Third Mainland Bridge before. Where are there potholes now?
You want to play?
Political way to distort. Let me tell you.
It's game on. Let the games begin.
On 99.3 Nigeria Info.
Welcome back to 99.3 Nigeria Info Lagos. This is Maternity Line Show. I am Zaynab Yekeen. As I did hinted before we went on that short break, I was going to tell you more about what today's conversation is all about. But first, I would love to give out the studio numbers, the WhatsApp, the telephone, as well as the social media handles. All right. If you're just tuning in for the first time, go over to our website right now at www.nigeriainfo.fm. That's our website. You can always listen again if you go on there. Also, do well to follow us all across our social media platforms. On Twitter, we are at Nigeria Info FM. On Instagram, at Nigeria Info FM Lagos. All right. On Facebook and YouTube, just search for Nigeria Info 99.3 and subscribe to our YouTube channel, like our Facebook page. My handle on Instagram and on X, that's formerly Twitter. Okay, Abisola is here. All right, Lagos, apologies. My digital producer, she's always in conversation with me when I'm on air. Abisola, Lagos is begging you. Okay, so yeah, I hope you have gone on all the social handles and follow us, like our page and subscribe to that. Mine is at KEENZAYNAB on IG and on X. Okay, so I do have Dr. Taofeek Olabode joining me on the show today. Dr. Olabode Taofeek Oladunni is a consultant, obstetrician, and gynecologist with over 2 decades of medical experience. He actually obtained his MBBS degree from the University of Ilorin, Probitak Doctrina. Yes, I'm a product of that school as well. And he earned the fellowship of the West African College of Surgeons in 2007 and the fellowship of Medical College of Obstetrics and Gynecology in 2009. And then he further specialized with a fellowship in IVF and reproductive medicine, positioning him as an expert in fertility treatment, assisted production, and reproductive health technology. So Lagos, we have the right person, the right doctor, the right medical professional for this conversation today. Doctor, good afternoon.
Good afternoon, ma'am.
Dr. Olabode, great.
Good afternoon, Zaynab.
Right.
Good afternoon, Zaynab.
Great to have you join us today on Maternity Line Show.
You're welcome.
All right, so like you already know, the conversation is egg freezing and what it means for modern motherhood, essentially to highlight the medical process of egg freezing to the realities and aspirations of today's Nigerian woman navigating motherhood. And of course, I understand that egg freezing is a form of assisted reproductive technology. So I would love for us to, I would love for you to educate us further on that. So doctor, let's get to it. Now, the first question I'll be putting to you is the basics. I would love for us to start from the basics. What exactly is egg freezing and how does the process work from medical standpoint?
Thank you, ma'am. Egg freezing is also referred to as oocyte cryopreservation. That is the medical term, oocyte cryopreservation.
All right.
And it's a form of, as you rightly said, it's a form of assisted reproductive technique in which an egg is preserved for future purposes. Process involved. When the patient, presents to the hospital,
right,
the doctor will examine the patient, investigate the patient, do some hormonal profile, and check the egg reserve of the patient. We use what we call AMH, anti-mullerian hormone, to assess the egg reserve. Also, the doctor will try and do a transvaginal scan to look at the eggs on both the ovary on both sides, left and right, and check the number of eggs that are available there. After working of the patient, if a patient wants to freeze her egg, after the investigation, the first thing is to stimulate the patient. You don't just walk into the hospital and say you want to freeze your egg. It's a process that you must pass through. One of the process, after investigation, one of the process is ovulation induction. The doctor will put you on. Yes, ovulation induction means that you want to induce your egg to grow. Because you are trying to freeze your egg, it's not one egg you need. You need many eggs to be frozen.
Right.
So the doctor have to give you some injections which may last 10 to 11 days. There are various methods of ovulation induction. We have what you call a short protocol, a long protocol, and ultra short protocol.
Okay.
Then we have what they call antagonist protocol. But I will not bother you all this medical. What it just means is that when you are coming for egg production, you might, for instance, now, if you start menstruating, the doctor might tell you to start your treatment on the second day of the cycle. So you are on that second day of the cycle, you are going to be on 2 forms of injection. You are going to be on HMG, which is FSH hormone injection, and you are going to be on boostration. when an FSH edit is to stimulate the growth of your egg. However, the boostulin is to prevent you from ovulating until the time is right.
Okay.
For you to ovulate. Do you understand? Because you don't want a situation where I will give you injection, I'll give you an appointment to come. By the time you come, your egg has disappeared. That's why I have to manage both. Stimulate your egg and ensure that you don't ovulate at the time I don't want you to ovulate.
Oh, is it possible for a woman to ovulate before the time of ovulation? Or is it because of this medical purpose?
Yes, because you're on treatment. If you're on ovulation induction, for instance, now I see you on day 9 or day 10, and I give you an appointment, come 2 days after. If I don't take care of suppressing your ovulation, it might come in the night, you may start having pain. Before you come to the hospital, all the egg has disappeared. So that is why I have, at the same time, as I'm stimulating you to produce egg, I have to give you a form of injection that will prevent you from ovulating prematurely. So that I will be able to collect your egg as at when due. So you are going to be on this form of injection for like minimum of 10 to 11 days, depending on how you respond to the treatment.
Okay.
So from like day 5 of your cycle, I will start using a transvaginal scan to follow what we call it follicular tracking, to follow the growth of the egg. Then, and in the process, too, I may be manipulating your hormonal drugs. Is that I increase it or I reduce it, depending on how you respond. However, when all the eggs, majority of the eggs are mature on, and that maturities is from 18 mm, I will keep on measuring the follicles. By the time the follicles are 18 mm and above, then it is time to ovulate. At that point, I will now give the patient another injection to trigger ovulation. If I give injection, we call it HCG, human chorionic hormones. If that one is given within 34 hours, I must withdraw. I must carry such a patient to theater to retrieve those eggs.
So 34 hours means...
so 36 hours.
Okay, 36 hours, a day and a half.
More than, 24, a day and a half. However, if you miss that period, if you come later than that, the egg might have disappeared.
Wow.
Yes.
All
so
right.
34 to 36 hours, I will take you to theater, get a consent form, put it to sleep transiently, and retrieve the egg per vagina, not operational.
Okay.
I will do a transvaginal scan. It's not operation. It's a minor procedure.
Okay.
But it has its own complications too.
Oh.
But you are not going to be caught whatsoever. It's just as if you are doing follicular tracking, you are monitoring your egg. But the difference is that between that monitoring is that I will put it to sleep because I need the needle to retrieve those eggs. The egg, you understand, we see on scan, composed of water and oocytes inside the egg. So it's being retrieved. What we are retrieving is like water. So that water, we have to check it under microscope to see whether there is egg inside that water. So when we see the egg inside that water, the embryologist will treat.
All right.
You understand? They are going to pick the.
All right, doctor. All this you have been explaining would happen when a client comes to you and wants her egg extracted for the purpose of safekeep for future egg freezing, essentially.
Exactly.
Yes. So, doctor, please, I'm getting a message that you may need to readjust your sitting position because it's a bit too up. I remember sending you the guidelines on how to, please do follow them. Thank you so much. I love the fact that you. I think this is great already. This is better. I love the fact that you started by emphasizing the fact that multiple eggs are needed when a woman wants to undergo egg freezing. Doctor, according to science, I understand that at birth, a baby girl is born with about 12 million eggs and in her ovaries, and gradually as she grows older, right, the quality and the quantity and quality of that egg or those eggs begin to decline, right? Now, I'm thinking, and this leads me to my second question, and the question is, At what age should a woman ideally consider freezing her eggs, and why is timing so important? I mean, that was a woman born with about 2 million eggs, if I'm correct.
In utero. In utero means when you are pregnant with a embryo, female embryo, at 5 months of that baby have about 7 million eggs.
7 million at 5 months.
At birth. Yes, at 5 months. Immediately such a baby is delivered, at birth, it's reduced to 1 to 2 million.
Doctor, what happened now? The baby wasn't menstruating in the womb.
It's a natural process. It's a natural process. So at the time of how will I put it? When a woman starts ovulating, menstruating, menarche, it has significantly reduced to about 500,000.
Okay.
So as women advance in age, the rate of depletion increases, as in the egg depleted as you advance in age. So the younger the woman, the better the quality of the egg.
So speaking of the younger the woman, the better the speaking of the younger the woman, the better the quality of the egg. At what age should a woman?
25, 26, 27, 28, 29, 30.
From 25.
But by the time a woman is approaching 40, yes, by the time a woman is approaching 40, from 37 and above, the chances of a woman conceiving is reduced by 50%.
Conceiving through the natural process,
yes,
as opposed to assisted.
Yes.
Okay.
Yes.
Okay. Now, how long can frozen eggs stay viable? And do they expire at some point at all?
Frozen egg can stay as long as you can afford.
Talk to us about affordability. As long as you can afford.
Yes, affordability. As I said, you didn't allow me to complete my process the other time. When the egg is retrieved and given to embryologist, the embryologist frees this egg. So, and it's kept in liquid nitrogen. That is the freezing. That is the media. That is the medium that the embryo will be. So they keep on filling the tank. So it can last for as long as 100 years, 50 years, 70. It depends on how you keep it, and how much liquid nitrogen you put into it. So until you power or defreeze the embryo egg, then you can use it when you defreeze it.
Thank you, doctor.
So you can freeze as long as you can afford. What I mean as long as well, because you'll be charged some amounts.
I hear.
Depending on where you are practicing. I'm listening.
Doctor, I hear egg freezing in Nigeria can cost between 1.5 to 3 million per cycle. Can you confirm that?
It depends on where you are doing it. Okay. If you freeze, they might see when you come for freezing, it's like you are paying for IVF.
Okay. Talk to us about that.
Because you are undergoing a form of You can't collect your egg without going through the IVF cycle. So if you are going through the IVF cycle with the freeze, you can't spend less than 3 million and above. The only difference with the complete IVF is that they are not going to proceed to fertilize that egg and transfer to you and allow you to develop and transfer to you. That's the only difference. They will stop at the retriever and freeze. So when you come back, they can defreeze and proceed with the process.
Okay. Now, doctor, talk to us. Given our healthcare infrastructure, how widely available and safe is egg freezing in Nigeria today? Is it something that is easily accessible?
Yes, especially in Lagos, Abuja, Port Harcourt.
Okay.
And it's evolving. Some other states, Edo, a lot of centers now come up on IVF. And if they have facilities for freezing, then they can go ahead and freeze.
Okay, doctor, I would love for us to talk about medical and success factors, especially if the process of egg freezing painful or risky, and then what should women know about the procedure and recovery. I'm coming back to that, but I would love to engage Lagos on this conversation. Lagos, the numbers to call to be a part of this conversation: 0201277093, 0201465790. You can as well drop me your message on WhatsApp, or if you have any question for Dr. Taofeek Oladunni, 0809-5975805 is the number to drop your WhatsApp message. Once again, 0809-5975805. Doctor, now let's talk about the process. Is the process of egg freezing painful or risky? What should women know about the procedure and recovery of this egg frozen?
The procedure most times doesn't last more than 30 minutes.
30 minutes.
Yes. Within 30 minutes, except on rare occasions. Within 30 minutes, some can even take 10 minutes. You are out of the theater.
Wow.
So in terms of pain, it's needle pain. But before that, they have to put you to sleep so that you won't feel the pain.
Anesthesia?
They can put, anesthesia for 20 to 30 minutes.
Okay. How about risks?
Complications, yes. The most fearful complications of egg retrieval or IVF, let's put it that way, is ovarian hyperstimulation syndrome. And it's very rare. You understand? Especially it's common in patients with polycystic COVID. That when you do the AMH, you realize that they have a lot of egg in their body system. So there are ways that you can prevent that. The stimulation protocol has to be different. The monitoring has to be different. The trigger drugs have to be different. If you do all those, then for such patients, you just have to freeze the egg so that it won't result in complications. All agents can be life-threatening. But by and large, apart from that, most times it's just normal, like occasionally infection, which the patient will be placed on antibiotics, then needle prick, bleeding, which can be controlled. Apart from that, then after the procedure, they can feel bloatness and slight pain for 2-3 days, then everything will subside.
But the patients would have been would have been informed of all these.
Yes, before the procedure, before the commencement of the whole process.
So it's very important they ask.
Patients have to sign consent form. And through this consent form, all the complications are listed in the consent.
All right.
Then we'll discuss with the patients the concerns.
Okay. Thank you, Doctor. I see people trying to call in. Lagos, do you think Nigeria society is ready to accept egg freezing? That's a form of assisted reproductive technology without judgment. Is egg freezing only for women who put career before family, or is that just a stereotype? Let me have your thoughts. Good afternoon, Nigeria Info.
Hi, Lady Zaynab.
Good afternoon, Mrs. Oboli, from your voice.
Good afternoon to the doctor as well, your guest.
All right.
Do we think Nigeria is ready? Well, times are changing, and basically, it's possible that people will start accepting these procedures as time goes on. First off, let me thank the doctor, but I just want him to do something. He's been mentioning a lot of medical
terminologies
during the course of his interview. So let him just sum it up. What is the economic importance and the significance of saving your eggs? Break it down, like in layman terms, basically. And I also want to use the opportunity to wish happy birthday to Mr. AY's triplets. Amazing kids. I've seen them. The wife is also a beautiful woman.
Thank you, Mrs. Obi. Thank you.
Thank you very much.
Thank you. So, Doctor, you appear to have understood her question, right? You smiled.
Yes.
Okay. Let's get a response on that.
Yes, egg food. There are indications for egg food. It's not everybody freeze their egg. For instance, now there are some medical conditions that will warrant a woman going for freezing of the egg. For instance, if a younger woman is diagnosed with cancer and she wants to undergo chemotherapy or radiotherapy, before the commencement of such process, such a woman is advised to freeze her egg, so that because if you undergo such process, you destroy all the eggs, so that they can be frozen. So when she's well, you can come for it and proceed with the idea.
So I remember one of the questions she wanted to get clarity on, the economic viable or the economic viability of egg freezing. Maybe an economic study.
Economic, I don't understand what the economic.
So I'm guessing it's a question for an economist, right?
For a patient that needs a egg, there's no amount of money that is expensive for her.
That's a punchy one. For a patient,
there's no amount of money.
Please repeat.
Because if you have a billion, if you don't have egg, you don't have egg. If you are a billionaire, you don't have. And you can't give what you don't have.
All right.
Because your genetic component is your genetic component. So it's not about issue of money. For somebody that needs a egg to reproduce.
All right.
Money, except it's not financially okay. Money is not the issue.
Okay.
Because you might have the money tomorrow, but you may not get that egg again.
For the general society, Nigerian society, money can be an issue, not even for women in other rural communities who cannot even afford it. Now, doctor, someone is asking a question. The person says, how about a 45-year-old woman? This is the question the person is asking, but he didn't put it in full. That can a 45-year-old woman also freeze her eggs?
At above 40, the chances, the quality of that egg is queried.
Is queried?
Then, yes, what I mean by queried is that as you advance above 40, the chances of conception with that egg is reduced, the chances of abnormalities is increased, the chances of abortion is increased. And most times these days,
40
and above, yes, not just abortion, not from abortion. You understand? These days, when you see patients 40 and above, there is a lot of egg deplete very fast. You see them, you hardly find egg.
All right.
I'm not talking about one egg.